Chronic obstructive pulmonary disease, commonly known as COPD, is the most common lung disease marked with difficulty breathing, chronic bronchitis, and emphysema being the two main components. Building up strength is important, and that requires activity. Here with us this morning is Yvonne Leonard with Nonin Medical to talk about staying active with COPD and monitoring your oxygen intake. Good morning, Yvonne. Good to see you.
Good morning. Thanks so much for having me on.
Been hearing a lot about COPD lately, but just to make sure that we all understand this disease, who's most likely to have COPD and what is it?
Well, there's actually 10 million Americans, or actually over 10 million Americans, who have been diagnosed with COPD, and most people are diagnosed after the age of 45. But one common string is a lot of them have been smokers.
It's recommended that those with COPD stay active. What kind of activities are we talking about here?
Well, really, whatever activities your doctor is going to recommend for you. So if you're a golfer, that might be golfing, walking, even some COPD patients run.
Isn't that something? How do we make sure then, though, that we're not overdoing it?
Well, there are some tools that are really helpful that allow you to actually get an objective number rather than just working on your subjective symptoms. I'm feeling breathless, I'm feeling really tired while I'm doing my activity. And so using a tool, a lot of patients find very helpful.
Well, those tools we have right here,
Exactly.
They're called oximeters. Never seen one before, but I love the fact that they're so small and so portable. Tell me exactly what these are, how they work, and you brought two examples for us here this morning.
Right. So an oximeter really reads the redness of your blood and gives you a reading that allows you to know how much oxygen is in your blood, and it also gives you a very accurate and very fast pulse rate reading.
The fact that this is so small and portable, I'm sure, makes it easier for a lot of people to want to take this with them and want to monitor, right?
Right. You can just pop it in your pocket and go. So it's important, though, to understand how you're using that oximeter and to purchase the right one. There are different kinds of oximeters on the market. Any oximeter that says FDA cleared means that it's a prescription product, so you need to work with your doctor and get a prescription for a product like that. There are also oximeters on the market that are health and wellness devices. They're not intended to help somebody manage a chronic disease, but they do offer the same benefits as a prescription version of an oximeter.
So how would we know, or how should we decide if myself or a loved one could benefit from an oximeter?
Well, I would talk to your doctor if you're looking at managing some sort of chronic disease. If you're interested in really having a tool that just helps you understand what your pulse rate is and SpO2 reading, then an oximeter that is just a health and wellness device might work just perfectly for you. So really, the best advice is always to talk to your doctor.
And what is an SPO? What did you call it?
SpO2.
What is that?
That's industry jargon. It means oxygen concentration in your finger.
That one I understand.
Okay. Sorry about that.
Well, thank you so much for coming by and making all of this very clear for us. Thank you so much. Good to see you,
Thank you.
Yvonne.
Good to see you, too.
And anyone wishing to know more about oximeters and monitoring activity levels for those with COPD, simply visit the website. It's www.gotononin.com.